But how have we come up with primordial or perhaps other kinds of health programs? We have studied the history of health and disease. Actually, we have studied the history of disease more than we have studied the history of health. However, even if we study disease, sometimes what we learn is how to support and promote health. So, over the years, we have come up with 4 groups or categories of programs that can support human beings at different stages, overcome whatever challenges they face with their health, so that they can come back to homeostasis, to as much health as possible. The 4 categories are primordial, primary, secondary, and tertiary. What is the aim of all these? I will leave primordial for the end. So the primary prevention programs are those which work with populations that are in the risk bracket. They have developed some risks, or they have shown the risks of developing a disease. The secondary prevention detects and treats pathological processes early, when intervention can be more effective. The patients, the people, have already presented the disease. And in the tertiary prevention programs, the aim is to modify risk factors and pathological processes to avoid relapses and further deterioration, so that the people who have already got sick with a disease can recover and maintain their health. So, primary works with groups at risk. Secondary works with patients with disease. And tertiary prevention works with people who have gone through a disease and they are now recovering, so that they can maintain their health. What is primordial now prevention? Primordial health programs work with healthy populations, healthy people. They work in a way so that they stop health problems or challenges before they start. Stop the development of risk factors for whatever mental, physical, emotional, or whatever other disease. Instead of modifying risk factors to control the development of disease, they work with the societal structures, the main determinants, the underlying determinants of health, so that they can strengthen those that develop health or lead to health, away from those that are connected or related with disease. So they change, in quotation marks, what behaviors or economic standards or environmental standards, so that we strengthen, empower those that promote health. As you can understand, although we use the word health, at the same time we also use prevention. And this is a good example of how the old paradigm remains in our language. What I mean is that the primordial health advancement programs work with healthy populations to promote health. However, in literature and in the language, communication language of health professionals, even among the academia, the words prevention programs still is used. But prevention is associated with pathology. It is associated with pathogenesis. It is a word associated with the decades, perhaps centuries long fight of the human being against the adversities of the environment, the pathogens, and this battle between the human and the environment, internal, external, seems to hold steady still. 60, 70 years ago, there was a new paradigm introduced by Antonovsky, and now his colleagues, students, although Adanovsky was not the first to use that, but with Adanovsky this wave started gathering force, salutogenesis. Salutogenesis is well connected with health. That's why it speaks about factors and determinants that are associated with the phases of health. How to develop resilience, for example. How we empower the determinants of adopting a more positive mindset and consequently behavior which supports this positive mindset, finding, for example, some rationale, some logic in what we do in our life, in our everyday world. So primordial health advancement programs are mainly designed in a way that promote this way of thinking. And it takes a healthy individual to think health and create health.